Take a bite, chew it naturally, then swallow when you're ready.
It's kind of remarkable when you think about it. This is speech pathology at work. This is also speech pathology at work. It's a newer area of speech pathology that deals specifically with brain-injured people. This woman suffered a brain injury in a car accident. Others may have suffered brain injury through stroke. Either way, two areas of difficulty for a brain-injured patient are the ability to communicate and the ability to swallow.
And since swallowing is an oral or mouth area and a pharyngeal or throat area, speech pathology became involved in the evaluation and treatment of swallowing in that regard. A lot of people envision that with certain aspects of speech that would encompass our ability to understand, our ability to be able to read and to understand what we read, our ability to write and express ourselves, and the ability to express ourselves verbally or non-verbally are isolated functions. And the truth is that thinking and language interact phenomenally together amongst many different brain structures.
It's a field that's seen enormous change within the discipline and the patient population. Take, for instance, stroke patients.
We just had a 26-year-old who just had a stroke, and probably a new surge of people in their 40s due to high blood pressure and stress. So there is now a new swing of 40-year-old in the 40s family of having a stroke. But when I was first in the field, you could have expected most of the people would have been 60 or older.
When Michael McCormick was first in the field, he had no idea where this career would take him.
It's gone far beyond my expectations. I would never believe that I'm doing what I'm doing right now. Back then you were isolated to doing public school or private clinics if you were lucky enough, and I was lucky enough to get into that offhand. But speech pathologists were not designated for hospitals or nursing homes or things of that nature. The job market was very narrow.
That's no longer the case. Today, the job prospects are broad and the areas of expertise very specialized.
When you go out into the field, each specialty of speech pathology finds their niche. So a speech-language pathologist who works in the school system, per se, is not going to be able to walk into this hospital and do what I do, but vice versa. I would not be able to walk into their environment and do what they do either.
It's amazing work with amazing potential. The potential for an injured brain to reconnect itself.
Johnson.
What a great human being you are.
I'm Alicia Callanan Mandigo for your health.